Just listening to the president there, a lot of background noise. It doesn't sound like parliamentarians were really convinced by his arguments.
Good afternoon to you, Nompu. Obviously, the DA is not of the view of the deputy president being away for about a month for his treatment in Russia, given some of the responsibilities that he has in terms of the rollout of the COVID-19 vaccine. They've been trying to say to the president there's some of the appointments that have been made in cabinet, and they've actually singled out the deputy president that actually, the suitability of these people is not in line with what government is committing to do in terms of good governance. But of course, the assurances that are coming from the president is that the deputy president has got a right to be covered in terms of transportation costs, as well as the flying costs to Russia, if he needs to be given the health condition that he was under. And of course, he's saying that that is not just a choice, it's a requirement by government that the deputy president, as well as the president, need to have security and have transportation wherever they go, and it's not their choice.
Now, while the DA raised the question, what is the general feeling among the opposition parties around Deputy President David Mabuza and his presence in his job?
Well, Nompu, as I've said, is that there was concern previously, not only now, that the length of time that he has undertaken to go for medical treatment in Russia was actually extended compared to the number of days that he had requested. You must remember that when the president made this announcement, it was billed as that he will be away for a couple of days, but it eventually became to something just over a month. So the question was that how is then some of these responsibilities that is given are able to function given his absence? One that includes that he is the leader of government, he's the bridge between the legislature, which is the parliament, as well as the presidency. And therefore, any complaints that comes to issues around the ministers not answering questions, they are normally taken through him. But in his absence, it was questioned what then happens, as well as some of the roles or committees that is actually entrusted with regards to COVID-19, given this deadly pandemic. How is those committees functioning in his absence? Of course, the president is saying that to question, the deputy president's absence is basically unkind and quite a terrible gesture, because any person should be given that space to actually go look after his health, and then now he's back, he's on the job, and it's business as usual.
So, Bulelani, we've got a couple more minutes. Just give us any other highlights that came out of the president's engagement with Parliament today.
I think, Nompu, I'll give you maybe three themes that have permeated in this oral and reply session. I think one of the biggest ones that came out is the issue of the mandatory vaccination program that has been built by the largest medical aid scheme in the country. Now, of course, the ACDP had posed the question as to, given the assurances by the president earlier this year, whether people will be forced to vaccinate, and the president confirming that people would not be forced. And now there are these new programs by some of these companies where they're saying that workers will be forced to actually vaccinate. And the ACDP actually arguing that this is a second form of apartheid, because people who do not want to be vaccinated are being discriminated against, because there's talk of a vaccination passports. You can enter certain public areas if you are not vaccinated, but you can't enter certain areas if you are vaccinated. So the question now is whether will people in the workplace be forced to actually vaccinate? The president again reiterating that people will not be forced, but of course in implementing some of these issues, if companies want to have this mandatory vaccination program, they need to actually balance the rights of public health as well as the choices of people who do not want to be vaccinated. Of course, going into detail that other issues that must be considered is issues of occupational health, constitutional rights of people, as well as the company's operational plans. And he's basically saying that if people do not want to be vaccinated, perhaps maybe companies can consider allowing those people to work from home. The second point that the president spoke to, and basically one of the issues that has actually troubled him or has been an albatross around his neck, is the issue of Marikana. A direct question was posed to him whether, when does it intend? And the answer is really not forthcoming, a direct answer. He's saying that there's no date set yet for him to go and address the widows, but he's still committed to go and address them, but he's still working on logistics as well as ensuring that he speaks to some of the stakeholders so that when he gets there, there is harmony, because he's saying that he's been engaging with AMCU as well as NOMSA, but he's finding that they have been having differences, and therefore once those differences are sorted out, he will then be able to work out the logistics of going to Marikana. Of course, the last one that we can talk to, issues of economy, again, is saying that there's still a very long way in terms of our economic recovery. And he's admitting that the current economic recovery plan probably is actually falling short, and therefore government does need to actually make an assessment of some of these economic recovery plans that it has on the table, and perhaps maybe taking bold steps in terms of actually increasing the levels of growth to deal with these issues of inequality, job creation and unemployment. Nombu?
Thanks very much, Bulelani, for those highlights. My colleague there, Bulelani Phillip.